good evening everyone. So here after the NEET-PG exam, the most awaited day of the year after the NEET-PG exam, we have come together for the recall session of the subjects of the NEET-PG. All the questions asked in the NEET-PG, will do a quick recall of these questions. And firstly, before going to the question, we'll do the analysis of the paper as far as ophthalmology is concerned. And as per the analysis, all of the questions asked in the ophthalmology section, they have been discussed previously in the workbooks, in the VSV sessions of the ADrPlexus multiple times. They have been discussed through various platforms via the ADrPlexus. And most of the questions, 70 to 80% of the questions, they were direct repeat from the previous years, only with minor changes, or the exact questions have been repeatedly asked, and they have been discussed in the ADrPlexus in the form of previous year questions, VSV sessions. And as far as ophthalmology is concerned, I believe that the questions were on the easier spectrum, and all the students whom I discussed the questions with, whom I discussed how the questions were, and those who sent me the recall, they were also agreeing to the point that the ophthalmology section was quite easier, and there were direct questions, no trickier questions were there. So let us take a quick recall of the questions. The first question is, a newborn child presented with big blue eyes with cloudy cornea. There is history of watering and blepharospasm. What is the most probable diagnosis? So this is a very direct, very easy question, discussed so many times in the VSV, in the workbooks. And last time, lately, we discussed in the 6 a.m. club, which was conducted only 5 to 6 days before the NEET-PG, and where we discussed the exact question that, and even the options we discussed, because it was a previous year question, options discussed were also the similar. So it is just, this question needed to take only 1 to 2 seconds, that where your option lies in the sequence of the option, you just have to take that time only, which will take only 1 to 2 seconds, because it was such an easy question. We know that a 2-month-old child with blepharospasm, with photophobia, with lacrimation, this is a triad of congenital glaucoma. This is a triad of the congenital glaucoma, discussed so many times. Congenital glaucoma triad, which was given in the question. And also we can rule out in the question is congenital cataract. We can rule out ophthalmia neonatorum, because it presents within the 1 month of the life. Congenital cataract, as we discussed in the image, that there will be a ring of the iris will be seen in congenital cataract. And now 2 options are left, mucopolysaccharidosis and congenital glaucoma. In mucopolysaccharidosis, there is cloudy cornea, but there are no lacrimation and blepharospasm. And also, since it is a progressive disease, mucopolysaccharidosis is a progressive disease. So the symptoms, they will appear later in life. Not a 2-month-old child will present with the whole cloudy corneas, because it is a progressive disease. Okay, very easy question. Next was, a 65-year-old patient presented with loss of vision on his right side. He has been diagnosed with space occupying lesion and is under treatment for the same. Where is the most likely location of the lesion present? Similar question with the same options, everything. It was discussed again in the 6 a.m. club, which was done, 5 to 6 days before the NEET-PG exam. So this was the same question, and where we discussed in that question only, we discussed that whenever the patient says that I am not able to see on my right side, he's talking about his visual space. He's not talking about where the fibers are going, where the retina is locating. Because in the patient term, right side is the visual field, and we know that, as the name suggests, visual fields right side both are gone. This is homonymous hemianopia. This is what? This is homonymous. This is homonymous hemianopia. Homonymous hemianopia, because same side of the visual fields are affected. And we know that homonymous hemianopia, they are the characteristic of the lesions below the optic chiasm, and they are always contralateral. These are the 2 characteristic features. They are always contralateral, and they have homonymous hemianopia, that is same side of the visual field is affected. Same side of the visual field is affected. So let us look at the options which were given in the question. Since the problem was in the right side of the vision, right side of the vision was gone, optic chiasma is gone, because in optic chiasma we know that there is bitemporal hemianopia. In left optic tract we know that or the right optic tract and right optic nerve. So we discussed earlier that the lesions below the optic chiasma are contralateral. So the right option has to be the left optic nerve. Left optic nerve, because right side of the vision is gone, so it has to be contralateral left optic nerve. Option C, there was a confusion whether it was right optic nerve given or left occipital lobe given. If it was right optic nerve, there is no confusion because the lesions are contralateral. Even if the option was occipital lobe, we know that in occipital lobe we are given with the macular sparing of the lesion is seen. And right optic nerve, in right optic nerve we see that there is whole of the vision is gone. In optic nerve, whole of the vision is gone. And below the optic tract, every lesion will have same side of the visual field affected, that is homonymous hemianopia. And in the optic chiasma, because of the nasal fibers, the temporal vision will be gone and there will be bitemporal hemianopia, which is opposite side of the visual fields. So it is heteronomous. So the optic chiasma is heteronomous. Bitemporal hemianopia, because nasal side of the fibers are crossing, so it will be bitemporal. We know that the visual fields and their representation in the retina are contralateral. Okay, this is the very basic, and by this only we can attempt the question when we know that the visual space and the representation in the retina are opposite. Okay. So the next question is, a 65-year-old diabetic female presented with colored halos and decrease in vision gradually over past 3 years. Okay, so she's a diabetic and she's presented with colored halos and decrease in which is the very characteristic of cataract, and also the age of the patient is suggesting about the cataract. But this was an image-based question and we were provided with the image. On ocular examination, given findings was seen and we can clearly see in the image that there is cataract to the patient. What is the diagnosis and management of the condition? Actually, there is very much confusion about this question and about the options actually, because in question there is diabetes, the mention of diabetes is there, and there is some confusion regarding basically the image, that the image of which image of the cataract was given, because some were saying that it was sunflower type of image was there, someone saying people were saying that it was given intumescent cataract. So let us keep aside the image, because even if the image was not given, the answer was direct answer. Let us look at the options. The first option was rosette cataract, and this is not eccentric, this is ECCE. So rosette cataract, we know that it is due to trauma. Rosette cataract is due to trauma. Next is sunflower cataract. We know that it is seen in Wilson's disease. It is seen in Wilson's disease. Zonular cataract is a type of congenital or developmental cataract. So we are left with only immature senile cataract, which is seen most commonly in diabetes. Another controversy with the question was that some were saying that there was one option as snowflake cataract. Even if there was one option as snowflake and other option as immature senile cataract, we will go with immature senile cataract. Why? Because immature senile cataract is more common than snowflake in diabetes. That is, senile cataract is more common than snowflake cataract in diabetes. And also, snowflake cataract is more commonly associated with type 1 diabetic. And in the question, our patient is a 65-year-old diabetic, that is a patient of type 2 diabetes mellitus, and snowflake is more commonly associated with type 1 diabetes. Okay, even if we keep aside all the confusion about the image and about the type of cataract, we can even solve the question with the management part only. Okay, first is extracapsular cataract surgery. Next is extracapsular cataract surgery with aphakic glasses. Next is lensectomy, and other is phaco surgery with IOL. we know that the treatment of choice or the surgery of choice in cataract is phaco surgery with IOL, and no other option has the same surgery. So even if we are confused with the type of cataract, we can go with the right answer by just looking at the type of surgery given in the question. So the answer to the question will be immature senile cataract with treatment as phaco surgery with IOL implantation. And these images about how these image cataract look, they have been discussed in the BSV sessions also. So this is the rosette cataract seen in the blunt trauma. Okay, as flower petal appearance, sunflower cataract in the Wilson's disease, snowflake cataract, diabetic. Okay, and these were one of the option about the zonular cataract, which is a type of developmental cataract, and riders are seen in it. Riders are seen in this. Okay, in the zonular cataract, there are riders seen, and it is a type of congenital cataract, most common congenital cataract associated with loss of vision, and most common congenital cataract as such, blue dot cataract. Okay. So I hope there is no confusion left in it. Next was a patient came with the history of dementia and noticed to have a golden yellow ring around the cornea. What is the most suitable investigation required in the case? I'm not sure about this question, whether it was an image based question and not. Even if there was no image, there will be hardly any change in the question. We know that a patient with dementia with a golden yellow ring around the cornea is KF rings. We know that it is KF rings just by the history and the clinical finding. We know that this is KF ring, this is a case of Wilson's disease, and we know that KF ring is due to the deposition of copper. So we know that there is we are going to do serum ceruloplasmin level. That is the very direct question, very easy question. KF rings, dementia, Wilson's disease, which type of investigation we are going to do is serum ceruloplasmin. Okay. So this was the even discussed in the INI-CET recall session, where it was given the diagnosis. There they were given the clinical image that patient has KF rings and what is the diagnosis. And in NEET-PG they have asked the opposite, that they have given the patient has dementia, he has KF ring, what are the investigation you are going to do. So it was a direct repeat from the INI. Next is a patient brought his child to the clinic where he was found to have mental retardation, skeletal muscle weakness, cherry red spot on the retina. So we know that in VSV also, in PYQ session also, we discussed cherry red spot. In TND, we discussed about the cherry red spots. We discussed about CRA, its management, the differential diagnosis of the cherry red spots, and it was even previously asked in NEET-PG also. So this is also previous year question. This is also previous year question of the NEET-PG. So we know that with the help of cherry red spot, we know that we have learned the mnemonic. We have learned the mnemonic of the cherry red spots as cherry trees never grow tall. Okay, we have learned about there. Here we have attached an image. We have discussed about the differential diagnosis of the cherry red spot, that is cherry trees never grow tall, that is CRAO, Tay-Sachs disease, Niemann-Pick disease, Gaucher disease, and trauma. So what were the options given to us? Tay-Sachs, Niemann-Pick, okay, these are in our mnemonic. Next is Hurler and Hunter, no cherry red spot seen. Now we are confused in the two options. Even if you know the mnemonic of the question, you are confused in two options. But as we go to the history, there they have shown that he was found to have mental retardation, skeletal muscle weakness. And we know that in Niemann-Pick disease, patient presents with hepatosplenomegaly. Patient presents with hepatosplenomegaly. There is a history of organomegaly given in the question. If it was Niemann-Pick disease, there must have been the history of organomegaly. In Tay-Sachs disease, there is no hepatosplenomegaly seen, there is no organomegaly, and there is mental retardation with skeletal muscle weakness. So this is the differential between option A and B. Option C and D we are ruling out directly, but between option A and B, because there is absence of organomegaly, hepatosplenomegaly, the answer goes to be Niemann-Pick disease. There is also one thing was that some where I heard that there is Gaucher disease. Some students said that Gaucher disease was also the option, and we know that we have studied it also that although we learn Gaucher disease in the mnemonic of the cherry red spot, but we also learn that Gaucher disease shows pseudo cherry red spot. It shows pseudo cherry red spot. So whenever there is question of cherry red spot, we have to tick mark Gaucher as the last option, because one time there was a question asked where the answer was only Gaucher. Other three options they do not show cherry red spot. There we have to tick mark the answer as Gaucher because it shows pseudo cherry red spot. So Gaucher, keep Gaucher as the last option to tick mark whenever you are asked about cherry red spot. Niemann-Pick disease, there is organomegaly, and in Tay-Sachs there is mental retardation, skeletal muscles weakness without organomegaly seen. So the answer will be Tay-Sachs disease. An elderly patient with decrease in far vision but does not need near glasses now. What could be the most likely reason for that? Okay, so there is elderly patient with decrease in far vision. Okay, the history suggests that patient has cataract, because in cataract, elderly patient and decrease in the far vision, there is cataract. And also this was an image based question, so you were given about the image of the condition. What could be the most likely reason for that? In the image, we can see there is slit lamp examination seen of the lens. You are given the slit lamp examination of the lens, and in this we can see there is hardening of the nucleus. We can see there is hardening of nucleus is seen. So there is hardening of the nucleus, that is the nuclear sclerosis. There is nuclear sclerosis. So the patient has nuclear sclerosis, there is hardening of the nucleus. Now what is happening is in nuclear sclerosis is because this central part of the lens has hardened, it has increased in its refractive power. Its refractive power has increased, and whenever we know that there is increase in refractive power, that is there is increased in the refraction, there is increased in the bending of the light, there will be increase in the bending of light. Now we know that whenever there is increase in bending of the light, what do we found? There is, when this is our eye, and when there is increased in bending of light, there is more convergence of the light, the image will be formed in front of the retina. And we know that what is this? This is myopia. Whenever the image is formed in front of the retina is myopia. So in nuclear sclerosis, the patient develops myopia, and because of this myopia there will be decrease in the number of his hypermetropic or the plus glasses, there will be a decrease in the number of his plus glasses, so the patient's presbyopic glasses will decrease, or patient will not need his presbyopic glasses. Okay, so there is the formation of myopia, which we also known by the name of second sight of old age. So this is also known by the name of second sight of old age. Now the options were index myopia, positional myopia, axial myopia, curvatural myopia. All were myopias. But we know that we have discussed in the optics part is the types of myopia. We know that the pathogenesis of this myopia or the second sight of old age is because there is increase in the refractive power of the lens, and this is due to the refractive index. This is the refractive index, so this is due to the increase in the refractive power, so this is the index myopia. Positional myopia is seen whenever, as the name suggests, whenever there is change in the position of the lens, that is dislocation of the lens is happening. So this is positional myopia. Axial myopia, when the axial length of the eye has increased, when the axial length of the eye lens has increased. Positional myopia, when there is dislocation of the lens uh, from its physiological place. And curvatural myopia is because of the increased curvature of the cornea. Okay, so as their name suggests, these are the four types of the myopia, and in nuclear sclerosis the patient develops index myopia, due to which his presbyopic glasses are the patient gets rid of his presbyopic glasses, and this question was included in our workbook questions. So this was the question about the second side of the old age. Next is, this image indicates which type of the refractive error. Now this was the image attached of the Sturm's conoid. This was an image attached of the Sturm's conoid. Okay, this was discussed in the workbook section of the ophthalmology. Even if you don't know this question, you can see there are two axes which are shown in the image, vertical and horizontal. Vertical and horizontal. We know that what is astigmatism is. In astigmatism, the power of the cornea is not equal in all the meridians. So all the meridians, they do not have equal power. At least, even if at least two meridians have different power, it is known as astigmatism. Why it is happening is because of the presence of uneven surface. Whenever there is unevenness in the surface of the cornea or lens, there is astigmatism, because it will lead to different power in different meridians. Okay, so it will lead to the astigmatism. And what will it do? That due to the astigmatism, because there is different power, so all the rays will not focus to one point. What is happening in the sphere, where whenever there is even surface, what is happening in myopia, hypermetropia, whenever there is even surfaces, all the light rays are getting focused at one point. Either they are getting focused in the front of retina, either they are getting focused at the nodal point of the retina or behind the retina. Okay, so but all the rays are focusing at one point. They are focusing at one point. But in astigmatism, because of the different refractive power, they are not getting focused at one point. As we discussed about the types of hypermetropism, types of astigmatism, we discussed that some rays are getting focused behind the retina, some in front of the retina, and some will be focused at the nodal point of the retina. So there will not be single focus. Okay, so this is principle is based on this term conoid. It is based on this principle that there will be not a single focus of the light where they are all are getting focused. So here in the diagram it is shown like horizontal rays, vertical rays, they are getting focused at different points. They are getting focused at different points. Okay, so this is used for the this indicates which type of refractive error, as astigmatism. This shows astigmatism. Here, as you can see again, is at this point, a point, vertical and horizontal, they are focusing at different point. Here there is horizontal focusing at different point. Here they all are focusing at different point, which is a very characteristic, or the basic mechanism of astigmatism is this only. So this is a very direct question. Which type of refractive error is shown? Terms conoid. There is astigmatism. Okay, so this is an image of Sturm's conoid. So the next question is, which of the following is the best diagnostic modality for this corneal condition? So which of the following is the best diagnostic modality? This is we known as, we discussed was dendritic ulcer is shown in the image. This was again an image based question. So dendritic ulcer was shown in the image. We know that we have learned as we use fluorescein stain. We use fluorescein stain whenever we diagnose in the clinical picture, in the history, we diagnose there is any erosion of the epithelium, any ulcer, we use fluorescein stain. Okay, and here in this image we are given the image of a dendritic ulcer, and we are asked about the stain used. So this stain is the fluorescein stain. Rose Bengal stain. No, rose Bengal stain, as we have seen in the images also, it is a pinkish type of dye which is seen. Rose Bengal stain. Lysamine green, because it contains green in name, but this is not fluorescein lysamine green stain. Next is two options are about the fluorescein dye. So the next option C is fluorescein dye with cobalt blue light and fluorescein dye with green filter. Okay, so again, this is confusing if you do not know everything about this fluorescein dye. Is fluorescein dye itself is orangish in color. Okay, it absorbs blue light, it absorbs cobalt blue light and emits green light. It emits green light, it absorbs blue light and emits green light. So the lesion we are focusing at, or the lesion which we are trying to see, appears greenish. Okay, itself it has orangish color, it absorbs blue light and it emits green light. Okay, it emits green light, it absorbs blue light, and in itself it is a orangish dye. Okay, so this is the fluorescein dye with cobalt blue filter, with the cobalt blue filter. Okay, so this is the option number C is the option, fluorescein dye with cobalt blue filter. Now, I just want to say that if you have revised ophthalmology, if you have, even if at the time of the revision you did not have the enough time to, revise your workbook, but even at the last moment, if you just revise your VSV sessions, your previous year questions, and your ophthalmology T&D, you will be able to, or you will be able to answer all the questions of the ophthalmology, because all these questions apart from workbook, because in workbook all of the questions they were included. Okay, they were discussed during the classes, but at the last part of the preparation of the exam, during the VSVs, TNDs and previous year question discussions, all these questions were included either in the direct form or with minor changes. Okay, so in my point of view, the ophthalmology part of the paper was easy, because all these questions have been discussed previously and they were not, tricky. Some of the options, they have been confusing, like one with the cataract, but that confusion might be due to because we do not know the exact picture. This question might be confusing because there are two options about the fluorescein dye, but if you know the basic of the question, it was a very simpler question. Okay, this was a very straightforward question. Second sight of the old age was actually a very straightforward question. Okay, this question could be confusing because if you have revised the, the mnemonic of the cherry red spot, but you haven't, but you have forgot to revise the features of the disease, this could be a confusing question. But you always have to remember that there is absence of hepatosplenomegaly, absence of organomegaly in Tay-Sachs disease. So the answer has to be this. In Niemann-Pick, there always been a history of hepatosplenomegaly. Okay, and in Gotcher, if suppose out of Hurler or Hunter, one option was Gotcher, you have to keep Gotcher as your last option because it shows pseudo cherry red spot. So Gotcher will be the last option. Even if there was no history and it was an image based question, and you were asked about the diagnosis, you have to keep Gotcher as your last option. And this was a very direct question, asked so many times, discussed so many times. This was, maybe confusing because of the image, but as we look at the question, it was an easier question to solve because we know that the surgery of the choice is phaco surgery. There is no other ECCE or aphakic glasses or lensectomy used in adult patient. Okay, because the patient given was a 65-year-old patient. We are not doing lensectomy in that. This was a very, very straightforward question, discussed so many times, and even we have discussed the lesions of the visual pathway. We have tried to understand, why this lesion is happening in this type of damage. Okay, so we know that this type of image will come in this type of lesion. We have learned them by heart, we have discussed, we have understood, because this question is type of an understanding question. We have understood it, so it will just take hardly 2 to 3 seconds to answer this question. And this was a very straightforward question, and very, favorite question of the examiners also, because it has been asked so many times. So I just hope that all of you have, answered very well in the ophthalmology part, because it was easy. And now, since all of you are free from your exams, so I just want to wish all of you very best for the results. You all of have given your best, and very best for the results. And just take a break. Do not take any tension about your results. Just take a break. Meet your friends and do party and whatever you want to do. Take a break. Do not stress about the results. You have done your part. Rest the results. They will be in your favor. You just have to believe in yourself. Okay. So thank you so much. This was the ophthalmology recall. And thank you so much, and all the best for your results.